good evening. Welcome to Know Your Fertility Hybrid Seminar 2023 organized by I Love Children. My name is Natasha, and the reason why it's called hybrid is because we've got our live audience here as well as you joining us virtually. Thank you so much for making time. I am your host for today. My name is Natasha, taking you through the session, and I've got some announcements before we start this seminar shortly. Do prepare some questions because we will have an interactive Q&A segment during the seminar later on where you may ask any of the burning questions where our doctors and experts will be more than happy to address later on. Last Friday, we featured fertility experts from KKH and SGH. If you missed it or if you want to review or rewatch some segments again, you may do so. The recording is on I Love Children Singapore's Facebook page. Today, we will be featuring experts from Thomson Fertility Center and Thomson Chinese Medicine with the beautiful faces on stage with me. Hello, you guys. Thanks for joining. Introducing Dr. Janice Tong, consultant ONG and IVF specialist from Thomson Fertility Center, experienced in gynecological complications and antenatal care, including high-risk pregnancies. Dr. Janice. We're also joined by Dr. Balaji, Chief Embryologist from Thomson Fertility Center, who has achieved more than 1,000 positive pregnancies from his ICSI in Thomson Fertility Center in the last 11 years. Wow, 1,000. Who kept count, doctor? I want to know. You do, of course. We're also joined by Ms. Xia, TCM physician from Thomson Chinese Medicine. Special interests in acupuncture and Chinese medicine to help women with fertility issues and postnatal recovery. Let's give them a hand, everybody. Thank you so much for joining. Thank you as well for being here. Take note, we will have a Q&A segment later on. So if you have any questions, maybe you've thought of one before even coming here, or maybe you think of one later on, we want to hear from you. Okay, and we also have got feedback forms that we'd like for you to fill in. So for those who are here with us at Scape, remember to complete your feedback form and you may collect your gift pack at the registration counter after the seminar. And those who are online with us, we have not forgotten you. Please also fill in the feedback form and you stand a chance to receive a gift pack, all thanks to our friends from Clear Blue. This is worth more than $100 when you complete the feedback form after the seminar terms apply. Alrighty, here we go. So if you're wondering where you can, do your feedback, send in your questions, you would have received the notebook at the start of, or before you came in here. The QR codes are all at the back. So that's where you can ask your questions later on, fill in your feedback form, and if you want to sign up for fertility consultations. I'll touch a little bit more on that later on. But right now, if you are a married couple embarking on your parenthood journey, we invite you to visit ilovechildren.sg to sign up for a fertility consultation or TCM fertility consultation. Terms apply. I Love Children's Know Your Fertility Wellness campaign is partnering with Thomson Fertility Center to give out couples fertility consultations. This is worth $400, and we just want to help couples understand better about your fertility wellness. And I Love Children also works with Thomson Chinese Medicine to give out TCM fertility consultations worth $200 to help you understand your body constitution and experience one acupuncture session as well. Terms apply. Welcome, welcome. Find your seats. Now, if you want, or if you're seeking peer support, if you're trying to conceive, you can also join I Love Children Fertility Support Group. This is a little community, and you can also ask questions anonymously or even share your personal experiences with others. I Love Children, it's a social service agency that's been around since September 2005 with the purpose of keeping Singapore young by advocating a higher priority to having children, educating couples on fertility wellness, and promoting a society where children are loved and mainstreamed. You may also subscribe to ILC, that's I Love Children, e-newsletter if you want to receive localized information through events, couples sharings, and also articles. You may also follow I Love Children on socials, Facebook, Instagram, and TikTok at I Love Children SG for event updates and parenthood tips. And if you wish to donate to us, you can also visit ilovechildren.sg and find out how you can donate and be eligible for 2.5 times of tax deduction. Now, this event, Know Your Fertility Wellness 2023, is organized by I Love Children, once again supported by Thomson Fertility Center, Thomson Chinese Medicine, KK Women's and Children's Hospital, Singapore General Hospital, APRW, Clear Blue, and Made for Families. Alrighty, now that's out of the way. We are gonna get into it, but I want to get to know our audience a little bit more. Before you came in, we asked you to fill in a poll, right? Remember doing that? Yeah, thank you so much for doing so. We're gonna find out. Let's get to know our audience a little bit. We asked if you came in here on your own or as a couple. Happy to report. More than 66%, I saw just now, right? More than 66% came here as a couple. We love that support. Next, how many of you are trying for baby or expecting or just curious to know more about fertility wellness? 81% of you here are all trying for a baby. Okay, you've come to the right place. You can ask your questions later on. Next question. How long do you think you need to try before getting pregnant? Okay, let's see the results. So the options are within 6 months, within a year, more than a year. 61.9% says more than a year. You need to try before getting pregnant. Is there a right answer for this, doctors? Of course. Okay, next question. How long did it take for you to get pregnant? Okay, for 14%, it's not applicable. Over 81% corresponds. You're still trying. Okay. Next question. For those who are actively trying to conceive, it's all right. How often do you try? Is it too personal? We're just getting to know them? I got the answer still. Okay, 66.7% only before or during ovulation period. More than half of you only try either before or during ovulation period. Singaporeans, we're very busy. We need to schedule these things, you know. I get it. Next one. Would you consider undergoing assisted conception procedures like IUI or IVF if you have challenges to conceive? Over 90% of you here, you're willing to try. Good to know. 9% says say no. Next one. How long will you try to conceive naturally before considering assisted conception procedures? Okay. 14.3% not applicable. More than half of you, 57.1% says more than a year. Okay, I get it. And we want to know what topics that you're interested in, either sexual intimacy, female fertility, male fertility, fertility after miscarriage. Actually, it's pretty split. You want to know everything. 15, am I reading this right? 71.4%, what you need to know about fertility treatments. Okay? 66.7% what happens in an IVF lab, and 71.4% how can TCM boost fertility. Perfect. They are here to answer everything later on. Okay, now virtual audience, we have not forgotten you at all. Let's see who's joining us online. How many people do we have joining us online? Do we know? Like a ballpark number? 200. Wow, 200 of you. Thank you so much. Next time we'll get a bigger venue that all of you can come down, okay? But thanks for making time. Let's see, do we have the results for the online poll? Okie dokie. Oh, this is it, of course. I'm not reading right. All right, 70% of you are a couple. Thank you so much for making time. 83% trying for a baby. Congratulations to the 6% who are already expecting. And also 11% just curious to know. Knowledge is power. Knowledge is key. How long do you think you need to try before getting pregnant? This is split. Everyone says the same thing, either within 6 months, within a year, more than a year, okay? Next question for the virtual audience. You say here, how long did it take for you to get pregnant? For most of you, you're still trying. Very understandable. And for those who are actively trying to conceive, personal question, how often do you try? This is for medical purpose only. Actually, 11% says 3 or more times a week. Must be nice. 50% say only before or during ovulation period. That is the common answer. I reckon this 11% all work from home, you know, or like they have flexible schedule. Again, must be nice. Would you consider undergoing assisted conception procedures like IVF if you have challenges trying to conceive? Most of you online, 82% you say yes. All right, and how long will you try to conceive naturally before considering? You'll try at least more than a year. That's understandable, okay. And most of you are interested to know about fertility treatments, what happens in an IVF lab, and how can TCM boost fertility. Okay, stay tuned because our doctors and experts will be addressing all those questions in today's seminar. Once again, welcome. Alrighty, now that's out of the way, I know a little bit more about you, how often you do it. A little bit more about me. My name is Natasha. I am 27. I am a radio DJ from MediaCorp 987, and I am a new mom. Can I say new? It's 2.5, relatively. I can't say that anymore. My daughter's 2.5 years old, and I knew for a very long time, because of the relationship that I have with my parents, with my mom, I wanted a kid young. That's always been appealing to me, and also I wanna be able to have the energy to raise a kid and also have fun and play with my child. So I'm all for being a young parent. However, I realized that age was not the only factor that I have to consider before having a child. Living conditions as well. So when I first got married, I was still living with my parents. And for that reason, I chose to take on the contraceptive pill. I wanted to wait until I have my own space before I have my own children, my own kids. Yeah, that didn't work because I got pregnant while on the pill. Not the pill's fault, it was mine. I miscalculated. I was in between places, and I missed a few. And I was afraid before going in, or before I started taking the pills, right? Because people were saying, or rather, my aunts were saying that, you know, when you start taking the pill, you might not be as fertile afterwards, you know, and I was worried like I was not going to be able to have kids afterwards. There was no window at all for me to even doubt that because within a few weeks of missing, I conceived. So I've got questions for you later on. But before I ask the questions, I think, so that's a little bit more about me. That's my journey, and ever since then, yeah, I'm now a mama of 2.5. And I got a place, so all is well. Dr. Janice, how you doing?
Oh, great.
You look beautiful.
Thank you.
Yeah, it's not good for my self-esteem that you're sitting beside me.
No way.
You are here to talk about fertility treatments. You are a consultant, ONG at Thomson Fertility Center.
Yes, that's right.
Okay, what can you tell us about what you're going to be sharing with the audience today?
Okay, before we start, I'll just tell you that the learning point from that story is that
I didn't know how to close
you wanted to be a young mother.
Yeah.
And that is very important.
Okay.
Yes. But since we can't turn back time, we've got to look forward. Okay, so yeah, let's move on.
Yes, thank you.
Let's have a look. Okay, so I'm going to share with you some slides. Okay, so in order to know what we need to know about fertility treatments, you need to know how a natural pregnancy occurs in the first place. So this is a busy slide, but if you just follow the numbers, essentially you're going to need a normal hormonal balance between the brain and the ovaries so that the brain can produce the right balance of hormones to stimulate the ovaries to produce eggs. You're going to need a good egg quality, and that of which age is the primary determinant. So that's why a young age is very important. And then the egg needs to come out. That's called ovulation. And then it gets into the tube. And then in a natural cycle, for every cycle, one egg is produced naturally. So after that, there needs to be a delivery of strong and plentiful swimmers from your male partner. And then after that, it has to get to the egg and the right window, the so-called ovulation window, the 36-hour golden window. And then fertilization is to occur, and then the tubes have to be normal for the fertilized egg, the embryo, to move through the tubes into the womb, and you need a healthy womb condition to house the pregnancy. So knowing all that, then how come we are not getting pregnant, right, after trying, and if everything has been found to be okay? So the thing to know is that our natural fertility rates is not very high. So even when all these conditions are so-called optimal, there are no other problems detected, your rate of getting pregnancy for every cycle will be is not very high, even when you're very young. So if you follow this, if you're 25 years old, you have about 20-25% chance of conception per cycle, which is not very high. And when you get to 35, that chance falls to about 15%. And if you're even older, then it goes even lower. And so that's why the time to conception is longer and longer. I believe that answers the previous question. So the journey to parenthood for some may be very long and tedious. So in this case, most people will start off with a fertility health consultation. So whether you choose to postpone plans for starting a family or you're planning to start a family, it's good to get a fertility health consultation early so that you can detect problems soon and early enough sometimes to optimize treatment and your womb condition in order to achieve pregnancy sooner. So at this consult, sometimes all that may be needed is just some advice on the frequency and timing of lovemaking and to understand the conditions that are required for higher chance of natural pregnancy. And that may be all that's necessary for some. Unfortunately, for others, as I mentioned, it may take longer and you may need to resort to other forms of treatment. So most people understand or know about IUI and IVF, but they are not quite aware of other modes of treatment that are available to help enhance your natural chances of conception or actually enhance your chances of success with assisted reproductive techniques like IUI and IVF. So surgery is one of these modes of treatment, and the aim of surgery is to restore or enhance the natural chances of conception, and sometimes they may be performed before IVF to improve chances of success of IVF. So this includes conditions of the ovary like endometriosis. So if you look at this picture here, I'm sorry, I think it's a bit blocked. This is a lady with endometriosis where it's an inflammatory condition where there's a lot of scar tissue formation in the pelvis, so that the womb and the ovaries are stuck to the intestines and the anatomy is very distorted. So as expected, you can have blockage of the tubes in this instance. You can have endometriosis covering the ovaries such that even if you ovulate, the egg is not going to get into the tube. Okay, so surgery can be done to try and restore the anatomy of the pelvis, as well as to improve your natural chances of conception, as well as to improve chances of success with IVF. Conditions of the womb such as fibroids, polyps, as well as adhesions within the cavity can be detected as well before surgery, and then the use of surgery in order to restore the normal condition of the womb. Next, we have ovulation induction. This is mainly for ladies with irregular periods and some with regular periods who may not be ovulating. So oral ovulation medications can be used along with time lovemaking. Now, time lovemaking is difficult. It is an entire topic on its own. People have written books about this, how to have sex when you're trying to make babies. But the idea is, unfortunately, the reality is that you have to get the sperm there. Even after getting the lady ovulating. If you just give ovulation medicine to the lady and you do not try, then there's no way you can get pregnant as well with just the oral ovulation medications. So whenever I prescribe this treatment to couples, it comes with a chart in order to schedule lovemaking. So yeah, that's unfortunate, but yeah, I try to teach them some practical ways about doing it. Okay, so along with ovulation induction, IUI, which is intrauterine insemination, can also be employed in order to get more sperm to the eggs at the time of ovulation. So IUI is simply an augmented way or natural trying. So how it tries to augment chances, so with the ovulation induction, we hope to get more than one egg out sometimes. So in some cases, not just oral medications are used, but injections are used as well. And then the eggs are monitored, and when the time is right, the doctor will recommend the trigger injection to cause ovulation to occur. So this is timed ovulation. And then after that, the IUI is performed so that the sperm can be put very, very near the eggs at the time of ovulation. And IUI, as I mentioned, can be used with oral medication injections. This is an ultrasound showing 3 eggs. We aim to basically get more than one egg. Around 2 to 3 or 3 to 4 eggs would be ideal. Too many is not safe because we're just going to shoot the sperm in. So if you have many, many follicles, that's not ideal for IUI in case you get too many pregnancies, some of which may be in the tube and not in the womb. So that's a very dangerous condition called ectopic pregnancy. So the overall success rates along with supraovulation, that means with more than one egg coming out, is 20%. If you do not use supraovulation, that means you rely on just naturally one egg coming out, or just oral medications, the success rates are going to be lower. So the cost range of each cycle is about $1,200 to $1,500 for the medications and the scans and the IUI, as well as the sperm concentration by the lab. Now, IVF is different from IUI. Essentially, we are using as many we want to get as many eggs as possible. So we use a lot of injections, hormonal injections, to stimulate the ovaries to get this. So if you see the ultrasound picture here, in comparison with the previous one, there are many, many more eggs that we hope to get to see on the ultrasound. So these eggs, again, can be monitored on the ultrasounds for their growth. And once it's ready, the trigger injections are used again to trigger the final maturation. We do not want ovulation where the egg comes out of the ovary. Instead, we are going to extract the eggs directly from the women's ovaries in a procedure called OPU, or egg retrieval. And this picture shows how it's done. I'm sorry, again, it's a bit blocked. The ultrasound probe is inserted into the vagina and a needle is introduced. This procedure is relatively painless, relatively simple, and very safe. And so this eggs are then passed to the embryologist, or Dr. Balaji here in the lab, will then perform the necessary to fertilize the egg. So what we need to know is that in vitro fertilization is not a magical bullet to get pregnant. It is essentially an accelerated means of trying for pregnancy because it bypasses natural fertilization. You do not need as many sperm around the egg. In fact, you only need one sperm to fertilize one egg. So the overall success rates are about 35 to 50%. This is considered quite efficient. It decreases with age because of the egg quality as well as the sperm quality. That is the limitation in IVF, which cannot overcome your inherent sperm and egg quality. So it's an option for couples with difficulty conceiving for longer term duration, mainly because it's the most efficient way of trying compared to IUI or natural trying, and is best suited for men, especially with severely low sperm counts. So the cost range, of course, is slightly inhibitive, $15,000 to $20,000, but there are government subsidies as well as MediSave available. The other thing is, if you are pregnant from this, generally your pregnancy will be highly medicated because it's artificially supported. So the conclusion is please go for a fertility health consultation early, especially if you have been actively trying to conceive for 6 to 12 months without success. Because our fertility rates can only decline with age. So the take-home message is there's no better time than now or soon. Fertility treatments should not be considered the magical bullet to get pregnant. You must always still try alongside with the fertility treatments. And then you seek any recommended treatments early to optimize your chances of conception. Thank you.
Thank you so much, Dr. Janice. You were saying you had to show your patients a chart to scare them. Scare them into lovemaking.
No, not scare them. To scare you, the lovemaking, to emphasize the point that you do need to try.
Right.
Because we can give those pills, but they're not magic pills.
Right. It's not helping us Singaporeans, you know, like we need to be forced to make love.
Yeah, so I do alongside tell them some practical ways to get round to trying, without too much stress.
That's great. You can also sign up for fertility consultation as mentioned by Dr. Janice, or even TCM fertility consultation at www.ilovechildren.sg. And don't let the figures scare you as well, because co-funding from the government is available. All the information that you need can be found on ilovechildren.sg. Thank you so much once again, Dr. Janice. Up next, we've got the one and only Dr. Balaji. Hello, hello.
Hello.
Your key achievement was the world's first live birth from frozen thawed embryos obtained after an in vitro maturation in the lab and intracytoplasmic sperm injection recovered from a surgically removed cancerous ovary.
Yes.
Let's give him a hand, everybody. That's Dr. Balaji for you.
Thank you. Thank you.
Dr. Balaji, Chief Embryologist from Thomson Fertility Center, you are going to take us through what actually happens in an IVF lab.
Thank you, Natasha, for the kind introduction. Yes, Dr. Janice actually explained what happens until the egg collection happens, right? So I'm going to tell you what's going to happen to these eggs and sperm given to us in the laboratory. So this is the first step. When the patient is ready for egg collection, the lab is informed about the egg collection date and time. So the lab gets ready. Just a day before the egg collection, we actually prepare the plastic dishes, which are sterile and single-use disposable, and also special substance called as culture medium, which contains all the nutrients that is required for the eggs, sperm, and growing embryo. So once we prepare that, the next day is the egg collection day, where the doctors, Janice actually will be collecting the eggs from the follicles as a fluid, and this fluid is sent to the lab. So as an embryologist, we have to isolate eggs from this fluid and then keep them in the incubator. So you can see in the picture under the labeling eggs, the egg looks like a cloud mass, right? So it has a lot of nerve cells, and you can see a central dot, which is the actual egg. It is surrounded by its nerve cells, which are actually supporting the egg by supplying nutrients. So once the egg collection is over, all the eggs are kept in the incubator, and we request the husband to produce a semen sample and submit to us. So once the semen sample comes in, we have to process the semen sample. I'll show you how they look like after processing. Meanwhile, we actually prepare the eggs also for ICSI. If you are going to do a conventional way of insemination, which is actual in vitro fertilization, we will be adding thousands of moving sperm to one egg. Whereas in ICSI, we need to remove these nerve cells, which would be a hindrance while we inject the sperm into the egg, and pick up one good-looking and moving sperm and inject it into the egg. So that is ICSI. Only mature eggs can be injected. The immature eggs will not fertilize even if I give them a good sperm. Okay, in the first window, you see a video which shows that how semen sample looks like under the microscope. You can see some of them are moving, some of them are not moving. There will be debris, everything is there. So we have to isolate the good swimmers, which is shown in the second slide. So you can see that all of them are moving, and almost 100%, and they are very clean compared to the first one. So this sample will be used for either conventional way of insemination or ICSI, ICSI. So in ICSI, we actually pick up a good moving and good looking sperm, handsome sperm. And actually, now we don't want this to move, so we slash the tail so that it doesn't move, and pick up by a fine glass needle. It's taken to the egg, which is held by suction, and the needle goes through the egg. The sperm is deposited into the egg, right? So after this, successful addition of sperm into the egg is done. Okay? So after this, all these eggs with the sperm are returned to the incubator. So next day, morning, we come and check whether the eggs are fertilized. You can see in the second red window that the egg is presented with 2 circles in the center. So this is the egg with normal fertilization. Anything other than this, either with 1 circle or more than 2 circles, are considered as eggs with abnormal fertilization, which are not usable. So the next day onwards, we look at the eggs, whether they become embryos or not. So about 24 hours after that, we see a 4 cell, and another day later, it becomes an 8 cell. So one more day, it becomes a mass of cells called morula, and on day 5, it becomes a ball of cells. This ball of cells is called as blastocyst. The outer rim, which we call as trophectoderm, forms the placenta, and another group of cells called inner cell mass, they form the baby when the pregnancy is established. So once we observe all this, we grade the embryos, and then the good quality embryos are picked up. They are loaded into a plastic tubing called the catheter, and it is passed to Dr. Janis, and Dr. Janis puts it into the womb under the ultrasound guidance. About 2 weeks later, the patient comes back for a blood test to see whether she's pregnant. And another 2 weeks later, if she's positive, another 2 weeks later, an ultrasound scan will be done by Dr. Janis to see whether the pregnancy is viable. Right? Any excess good quality embryos can be frozen in liquid nitrogen at minus 196 degrees Celsius, and it can be kept for any number of years like that. Okay? So whenever a patient wants to use these frozen embryos, we can thaw them and then again do an embryo transfer to achieve another pregnancy. So this is what we do in the IVF lab.
Thank you, Dr. Balaji.
Thank you.
You know, one of my cousins was an IVF baby. And yeah, she's the most mischievous, naughty girl. And I'm like, how? You were handpicked. How do you turn out like that? No excuses. But all jokes aside, thank you so much, Dr. Balaji.
You're welcome.
If you have any information or if you need more information, you can find them, as always, at ilovechildren.sg. If you have any questions during either of the presentation just now, remember the QR code at the back of your notebook. Feel free to drop in your questions later on. We'll be addressing them after we have a chat with the lovely Miss Sia. Hello, hello.
Hi.
I've been looking at you from here, and you're a sight for sore eyes. I don't think I've seen you not smile. Thank you, Miss Sia, for joining us. You are also the head of Thomson Chinese Medicine, and you have special interest in the use of acupuncture and Chinese medicine to help women with fertility issues and postnatal recovery. Now, we have something else to also consider. Thank you so much. What can you tell us about TCM and how it can enhance fertility in males and females?
Okay, so how TCM can enhance fertility for both males and females. I think you have heard from the 2 doctors here, you know, medicine is very advanced in doing what the body cannot do. So for example, if through fertility screening you find like you are low in some hormones, you know, so with medication it's very effective to bring it back. Or for example, if you need some help out of the body, right? Yeah, and all this can take place in the lab. But for TCM, the focus is very much different because for TCM, we are still focusing on the body itself, what the body can do naturally on its own. And our objective is to employ the different TCM treatments to boost that organic function. Yeah. So for both males and females, I think we can use an analogy, right? Yeah, just now we see like how from Dr. Tong's slides, you know, the egg, first there must be the hormonal balance that then releases the egg in the first place, help the egg to grow of the right size and then to be ovulated where it meets the sperm and then it travels down to the uterus and then it implants, okay? So for TCM perspective, if we look at it like, okay, what are the ingredients then can help both male and female to optimize the natural conception environment? So for males, what are some of the herbs, that can help to balance your constitution that can then optimize this sperm quality and production? And for women, your womb, right, is like a soil. You have a seed. First, you want to make sure like your seed is of a good quality, right? Yeah, and when that seed travels through, come down to the soil, how do we optimize the soil condition so that implantation has a better chance of taking place? Yeah, so, and this is what we try to do with TCM treatment, understanding, the constitution. That's why we emphasize a lot on the individual constitution. Because if you were to look around, all of us look different, right? None of us are the same. So similarly, we can be the same age group. We might have same or similar fertility problems or no fertility problems, but we just taking too long, right, to conceive, yeah? But our underlying problems are usually not the same. And so it is for the TCM physician to work with the couple to identify, okay, what could be possibly the imbalances that it's, either in the wife or the husband, and we work on that and then optimize the condition for the natural conception or even for IVF, because ultimately, once the embryo is in the womb, you still need the body, to support that pregnancy, yeah, for that 10 months, yeah.
Wow, that was poetic, Miss Yang. Thanks for sharing. Very nurturing as well. What are the types of fertility treatments then that TCM provides?
So I think most of you would be familiar with the use of Chinese medicine. So Chinese medicine is like your fertilizers, right? Yeah, so to nourish, whether it's male, female, yeah, there's, so from Western, we know the supplements, zinc, selenium, etc. that can help. But from TCM perspective, the angle is slightly different. Yeah, so you hear a lot about, strengthening the kidney. How about it's about always the kidney yang for the males and kidney yin for the females, but that's not true. It's always about a balance, yeah. So Chinese medicine can do that, can address, improve, the balancing in the constitution. So for, what is supposed to happen, it can take place better. Acupuncture, on the other hand, is to improve. We always talk about improving blood flow, improving oxygen, to your reproductive organs, so that with sufficient oxygen blood flow, then our organs perform better. So better blood flow to your ovaries can help the eggs to grow better, and better blood flow to the womb can help with the lining thickness that can then help with the implantation process.
Right. And who would you say therefore? Is it more for the males or females or together?
So generally, we advise couples to come together for the first consultation. Usually, before couples come, they sort of have a feeling, whose problem is it? Yeah, so, and I think we are not, putting, but for TCM perspective, it's always working on both together. Yeah, there's always something to work on. Yeah, so coming in together, going through the journey together, it's just that maybe for one party, we might say, okay, in your case, we might have to do acupuncture and Chinese medicine simultaneously, and then for the other couple, maybe it's just one of the two treatments. So it all depends also like whether we are trying naturally, we are going for IVF, or if it's a history of miscarriages, yeah, then we go through that first session, we set timelines and goals, and then we work out the treatments accordingly.
So you're saying it is possible to complement TCM together with Western treatments at the same time?
Yes, that's what we do. Yeah, so we will usually take the directive from the doctors. Doctors will go through the treatment plan. And for patients, let's say if they are embarking on IVF, maybe in 2 months' time. So in the 2 months of preparation, then we will help, to prepare the couple, maybe through acupuncture and Chinese medicine. And once the IVF drugs start to kick in, then usually we will take away the Chinese medicine and just go with the acupuncture.
Right. When should couples actually consider TCM then?
It all depends. Like, you know, there are some couples, when they think about fertility, they will think about TCM first, and then there will be couples with, you know, yeah, it's your preference also. But I would think that it's always good if you have been trying for a year with no success, to always get a fertility screening done. So these are like your data, right? Yeah, so you know what is the baseline. And with that results, you come to the TCM, and it's also we have objective data to work with, and then we can say, okay, let's do TCM for 3 months, 6 months. What are the results that we are aiming for, or what are we expecting? And that baseline data will be very useful for us to measure the outcome.
That's very nice. Thank you so much, Ms. Ya. If you have any questions that's not been addressed yet, or if you want more details, or you want to ask anything further, feel free to scan the QR code and drop your questions, because I think now we can start the Q&A segment. Alrighty. Also, likewise, for our audience joining us virtually, feel free to drop it in the Q&A box, and we will be reading out your question for the doctors to answer. Okay, so the floor is now open. Once again, if you've got questions about fertility treatment, whatever that's been mentioned here, or TCM as well, feel free to do so. Ask away. Here we go. This first question is for Dr. Balaji. What is a good egg size for egg mature retrieval?
Actually, this question should be answered first by her.
Okay,
Then
okay.
I will answer from the laboratory point of view.
Oh, all right. Yes. So outside of the lab, let's hear from Dr. Janice.
Yes. So we generally look at 16 to 18 millimeters for the follicular size, because what we are seeing on the ultrasound is actually follicles. The egg is microscopic, surrounded by fluids and cells. So that's what we are measuring. So it's not really the egg that we are looking at. But yeah, so in general, a follicle of about average size of 16 to 18 millimeters would be deemed mature enough for retrieval, at the time of the trigger for ovulation. So the thing is, you are not going to get consistently every follicle at 16 to 18 millimeters. Okay, this is not happening. So you're going to get an inconsistent growth. So there will be, what we are trying to achieve is the largest proportion of follicles at that ideal size. You're going to have some bigger. We hope they're not overcooked. And then you are going to have smaller ones, which are probably not going to be mature enough.
Right. Is there anything that we can do on our side to...
The lab will...
Yeah, in the lab, actually, I showed you the picture where we remove the outer cells of the egg, and then we look at the egg. So a mature egg should measure around 150 to 200 micron in size, in diameter. I hope you all know how much is a micron. 1 micron is 1,000th of a millimeter. Yeah. Right? So egg is so tiny, you can't see it with the naked eye, so you need microscopes. We actually have seen even eggs larger than that, which we call as giant eggs, so they are not usable. And similarly, smaller eggs, which are not mature, are also not usable. So the ideal size in the laboratory for the egg is about 150 to 200 micron.
All right, thank you so much. I hope that answers the question. Next one for Dr. Janice and Dr. Balaji as well. What is the IVF live birth rate for women above 40?
Okay, so yes, live birth rate is the most interesting fact, because we have quite high pregnancy rates, over 30% for those above 40. But unfortunately, ladies above 40, pregnancies above 40 are subject to an increased risk of miscarriage, birth defects, as well as other complications. So in that sense, the live birth rate for women above 40 generally tends to fall to slightly above 10%. Or even less, yeah. So that's unfortunately the problem with age.
Understand. Also for Dr. Janice, what supplements to consume in order to nurture good quality eggs?
Okay, so there are not that many things that can be used. What is most studied, or what there's most evidence, are things like CoQ10 enzyme. I'm not sure if people in the audience and at home have heard of this, but it's quite popular. So that's one. There is also other supplements known as DHEA, which are to help those with very low ovarian reserves, low egg counts, to try and boost their quality of eggs before IVF.
Okay, if it's outside of supplements, what can we eat to increase uterus lining? This is for both Dr. Janice and Miss Ya.
Miss Ya?
So I would say like there's no superfood, because I think like if you were to Google and you will find a long list, you know, even in the IVF forums, the chat groups, I think there are many very kind souls who share like, you know, what worked for them, and there's just a super long list. Yeah. So I will always advise patients, you know, just adopt those that are natural for you. Don't go all out, you know, like try too hard to include some of the superfood, right? Yeah. So because from TCM perspective, it's all about moderation. Yeah. So, well, we do have some help, like to, you know, to identify, because based on your constitution, so what are the types of food that might be suitable for you and that you can increase in that type of food. Yeah, but in general, there is no superfood, and but of course, TCM is always advocating, especially for the ladies, right? No cold drinks, try to cut down on raw, cooling food. Yes, and usually I say, okay, try to cut down on the bubble tea, and then some people say, okay, that's it, bye. You know, no more TCM, because like, you know, the bubble tea is very important. Yeah. So yeah, that's in general TCM.
I would like to add that in some conditions such as endometriosis and adenomyosis, these are inflammatory conditions. So in general, if you want to do something to help these conditions, then avoiding pro-inflammatory things in the diet, so for instance processed sugars and therefore your bubble tea, and taking more anti-inflammatory things like probiotics, turmeric would probably help. Yeah, I mean the benefit is not well established because, you know, it's very difficult to quantify or measure these things. But I mean, if you wanted to do something to help yourself, then these are some of the things that you can try.
Thank you so much.
Maybe I add on to what Dr. Tong says. You know, like there's so much supplements out there, right? Yeah, and one way is you can listen to your body. Is like, you know, when you take this supplement and it helps, it makes you feel good, right? Versus there are some supplements that you take and you feel nauseous, you feel like you're not able to digest, or it makes you feel more heaty, then probably that's not the right one. I mean, this is a very common sense way of making, because there's just too many out there. Yeah.
It's trial and error, and like
Yes.
everyone's body is different. So listen to your body and eat everything in moderation. And you're not going to get scolded by Miss Ya anyway. Look at that. Bubble tea, she's still smiling. I love it. Be my doctor, please, Miss Ya. Okay, next one for Dr. Balaji. What is a typical procedure in Singapore to fertilize egg with sperm? Is any ICSI involved?
Actually speaking, we don't have IVF centers in Singapore, to just joking. They should be called as ICSI centers. ICSI has a higher fertilization rate. So I showed you two different methods of insemination. One is putting so many thousands of moving sperm with one egg. So that is conventional way, which is the in vitro fertilization technique originally. Then later came this single sperm injection into the oocyte. So nowadays, most of the centers are doing more and more ICSI. So ICSI is the main way of fertilizing the egg nowadays.
Okay, this is for Miss Ya. Can acupuncture be continued after embryo transfer?
Well, so many people think about needles and pregnancy, and I think many of us, you know, think like, wow, so not safe, right? Yeah, imagine I'm pregnant and I'm still doing acupuncture. But on the contrary, actually, acupuncture is very safe, yeah, even for pregnant ladies. So in fact, we advocate, we encourage our patients, you know, even when they test positive for their pregnancy, to continue their treatments all the way until they pass their first trimester. Yeah, because this is simply because, like, you know, I would sometimes patients ask, so when is it more important to have acupuncture? Is it just before embryo transfer, or is it after embryo transfer, or, you know, or once we test positive, then that's okay, you know, we can stop all treatments? Because many women are still not comfortable with the idea, like, I'm pregnant and I'm doing acupuncture. Yeah. So there are points that are not suitable to do during pregnancy, and definitely we're very careful to avoid these points, as well as the points on the abdomen. Yeah. So once after transfer, we don't do points on the abdomen. We are very careful what points to not to do. And after the positive test, right, yeah, we still continue, because you still have to continue to nurture, continue to drive the circulation to the womb, you know, to support the growth and the development. Until we are about 11 or 12 weeks, then we will stop. Yeah, then sometimes patients get so used to the treatment, then they say, oh, can we continue, you know, into our second and third trimester? Well, essentially, there's no danger, but there's also no benefit. So, but if patient feels comfortable, then yeah, we can continue. But if not, usually we stop at the end of first trimester.
Ah, I see. Okay. Okay, thank you so much. This next one, I mean, obviously no questions are for me, but if you have any questions for me, it's at your own risk for me to answer. Dr. Janice, what are the typical symptoms for OHSS? What is that? What is OHSS?
OHSS stands for ovarian hyperstimulation syndrome. It is a complication of IVF treatments. So unfortunately, in the pursuit of more and more eggs, sometimes some ladies' ovaries will go into overdrive. So actually, before recognizing the symptoms for OHSS, it's important for the doctor to recognize the risk factors that you have for OHSS and try to mitigate these risks or to avoid this complication altogether in your IVF protocol. And if, let's say, you still unfortunately do develop symptoms of OHSS, the main thing to look out for would actually be bloating to the point of it being painful. Yes, so most people are going to get a bit bloated with the hormonal injections and the trigger injections before the egg retrieval. But it's usually, you can ignore it. Usually you can go about your own activities. It's uncomfortable, but not, you know, to the point of debilitating pain. So the pain is the main thing. Feeling very, very nauseous or even vomiting as well, along with the pain. Yes, so this is definitely when you need to seek medical attention.
Right. Okay, next one. For either Dr. Janice or Dr. Balaji, how can we improve implantation while trying naturally?
I think I'll take it first. Okay, Ken. So, unfortunately, implantation is not completely understood, which is the reason why we haven't been able to get round to more than, you know, that inherent chances of success after putting in the embryo. But what we do know is that the embryo is the most important factor, or rather the main determining factor for implantation. And if the embryo that we put in is normal, most of the time, more than 50% of the time, we're going to get implantation. So the embryo, how good it is, whether it's genetically normal, a lot of it is determined by your age and the inherent quality of your eggs and sperm. So after that, then we talk about the condition of the lining, the soil, as Ms. Xia puts it. Okay, so there are some investigations and things that can be done to check whether your lining, as well as the your overall body's immune system, is able to accept these embryos, which are half foreign to you. So some of these investigations can be done, and if things are discovered, certain things like an overactive immune system, then some medications or adjuncts can be added to your IVF protocol in order to support this implantation. Or if you're trying naturally or using IUI, these adjuncts can also be used to try and improve implantation. But aside from that, we can't, since it's not completely understood, we will not be able to, you know, completely add anything to achieve 100% implantation, yeah, at this stage for now.
Dr. Balaji?
Yeah, actually, it's a million-dollar question. Like what Dr. Janice said, it's not understood completely. So we know only the tip of the iceberg. We do not know what's happening beneath the surface. Right? From the IVF data, we can say that nearly half of the embryos are chromosomally unstable. Right? So, but I don't know whether we can apply this to the natural pregnancies, because we do not know what's going on there. So if somebody finds an answer, there will be a millionaire very faster.
That's great. I say keep trying. Practice makes perfect. Again, must be nice to do it more than 3 times a week. Okay, now this is for Dr. Janice. An option to treat male fertility?
I think this is referring to males with low sperm count because that is usually the main problem with male fertility. So males with low sperm count, well, there aren't that many options besides IVF. Yeah, so supplements and all this can essentially optimize your sperm condition, your sperm quality, but in general, there's not much that can improve the actual sperm count. Because the idea about the low sperm count is that it could be a low production issue or an obstruction issue. There is no medical treatment for low production, and there is also no surgery that can be done for the obstruction issue. So, well, low sperm count is not expected to affect your life expectancy. It's not life-threatening. So essentially, it is the fertility issue, which is addressed with IVF and ICSI especially. If you have no sperm in the ejaculate, so some people have no sperm at all, in these cases, there is an option of trying to retrieve or obtain sperm directly from the testis itself through a surgical procedure. And if there is sperm found in the testis, then this can be passed on to the lab, and again, IVF and ICSI is used to try and obtain pregnancy.
That's very nice. Thank you so much. This is for Miss Sia. What are the typical symptoms for cold womb, and what can you suggest or recommend to eat to create a warm environment for a successful pregnancy?
So this is the type of question that I fear to answer with my doctors around, right? Because it's like, how does it get cold? Where does the wind come from? What kind of dampness are y'all talking about? You know, Chinese we say 湿气, right? Very wet. Yeah, so, okay. So to be more scientific, right? Yeah, please spare me. Let me answer it like this. So, some of us may know, like after ovulation, our body temperature goes up, right? Yeah, and for the next 2 weeks, it stays high. And if there's no pregnancy, then the temperature drops and then your menses come, right? But if the pregnancy is successful, your temperature continues to stay high and sustainable pregnancy, right? So, but there are some of us who have this progesterone deficiency, meaning even before that 14 days, my temperature starts to fall. Yeah, so that is one symptom of a cold womb. Means that the temperature is not able to sustain, meaning it's a deficiency of progesterone, which in TCM terms is a deficiency of kidney yang energy. All right, so that's one way. Is there another question to that?
How do we keep it warm?
How do we
What to eat to create a warm environment for a successful pregnancy?
What to eat? Okay, so in TCM, actually your digestive function is very important for circulation purpose. Yeah. So I think the question then is, how do we take care of our digestive system so as to keep it in a good condition? Because digestive system is the one that absorbs the nutrients, you know, break it down, and in TCM terms, we say convert these nutrients into supplies of energy and blood. And when you have a good supply of energy and blood circulating throughout, then, you know, generally you should be fine, right? So how to keep the gut healthy? And in TCM, we always advocate, like, you know, have your meals on time, you know, try not to skip meals. Then some people will ask, how about intermittent fasting, right? For some of us, we need that. Okay, but that one, you come to my clinic and look for me. We discuss separately. But in general, have 3 regular meals and always try to, Chinese again, we say 清淡, 清淡 means plain, not so extreme tasting. You know, because modern diet, right, is very extreme in taste. We go for the most spicy, we go for the most sour. You know, anything less than that, there's no kick, and we don't like that, yeah? So when it comes to TCM, it's like, you know, we have to go back to basics, right? Eat food that nurture your body, you know, warm soups, stews. When it comes to cooking method, steaming is preferred, or low heat stir frying. Deep fry is not recommended because the high heat destroys all the nutrients, not tasty. You know, so I can see like all your faces, all of you don't like me already. Nobody's coming for TCM. But we try, like, you know, I know like, you will see me drinking bubble tea sometimes also. So, you know, they say, hey, Miss Ya, you know. Yeah, so moderation, right, means like 80%. You know, we stick to this very good diet, and then 20% of the times, or, you know, if you can, even lesser, yeah, then we indulge. Yeah, that's fine, okay? So keep your gut healthy. That is very important, yeah.
Okay, that was a personal attack. I travel with a soy sauce in my bag. Like nothing is flavorful enough. But thank you so much, Miss Ya. That was very insightful. This is another one, Miss Ya, from a husband. My wife says I should avoid drinking cold drinks to have higher chances of having a baby. This is by the husband. Is that true?
So usually the cold drinks, right, I usually impose on my female patients only. Yeah, so because generally the male body, right, is more, the yang is more dominant. Yeah, whereas for female, right, the yang tends to be more weaker. So that's why, yeah, so if you're the husband, where's your wife? Yeah, husbands generally, yeah, you are quite safe. So you can come and see me, no problem. Yeah.
Quite safe in that front, but safe with your wife? Are you thinking of her? Character. I'm kidding. Okay, next one for Dr. Janice. What are the side effects of ovulation stimulus injection? Are there any risk of getting cancer?
Okay, so it's good to know that there has been no known evidence of getting cancer of the ovaries, cancer of the womb, cancer of the breast from IVF and the ovarian stimulation injections. The side effects commonly are hormonal, so feeling a bit hormonal, some mood changes, some skin changes, and bloating. Bloating itself is not a bad side effect to have, because when you have bloating, it is an indication that your ovaries are responding. You might be getting more eggs. If you actually have no symptoms of bloating in general, your ovaries may not be responding and you may not be getting that many eggs.
Okay. Next question for Dr. Balaji. Does the laboratory environment in each hospital affect the IVF outcome to an individual? This person failed their first cycle of IVF, and they're considering if they should go to another hospital to try IVF again.
Okay. I'm talking about Singapore only, okay? So in Singapore, we have a standard to follow. So which is actually all these IVF centers and their labs in Singapore are audited by an Australian agency based on the recommendation from Ministry of Health, Singapore. So we need to achieve certain standard to be functioning, first of all. And then the standard is not set low or in the middle bar, it's very high bar. So all the labs must meet this. Then on top of that, every year, all these labs are actually monitored by Ministry of Health for the performance. So there is a quality control and quality assurance maintained by all the labs. The differences could be the embryologists who are handling the gametes and embryos, and then the nutritive substances that I spoke about, the culture medium, may be different between the labs. But nowadays, all of them are standardized, right? So from this question, I understand that it's your first cycle failure, which can happen to nearly 50% of the patients if you are 30 or below, right? So you may try one more cycle with the same center.
For Ms. Ya, can TCM medicine help to increase sperm morphology, or is acupuncture required? How long will it take to improve?
Okay, I think Miss Sia
Don't
wants me
look
to
at
say
me.
something about sperm morphology first.
Me too, actually.
So, sperm morphology refers to the structure of the sperm. It's just that international criteria has dictated that 4% or more of the sperm needs to have a defined structure. Now, the thing is, most men do not meet this criteria. So 0%, less than 1%, or 1%. So whoever asked this question, you're not alone. Okay, it is the norm rather to have this number than to actually meet the criteria, which is 4%. So the thing is, what we have found is that people with this sperm morphology, they can still get pregnant naturally. So it is not considered to be significant or an indicator of poor semen quality or poor sperm quality. So in which case, treating this number may not be such a good idea.
So should we treat low motility, low volume?
Yes, I think count and movement are the most important parameters, so that is what you can look at. Yeah.
Yeah, actually, to add on to that, don't look at only one parameter. So the sample may have a low normal morphology, but if it has a high count and high motility, this will be compensated. Right? So just because of only one parameter, you shouldn't be worrying.
Okay. All right. Okay, we've got 20 more minutes. We're going to try our best to answer all your questions that you've sent in. Thank you so much. This is for Dr. Janice. When is the best time to go for a fertility check? And yeah, is there any specific timing, especially for the guy?
Okay. So if you're aiming to get a scan done that will best evaluate the lining of the womb as well as your ovaries, then you should go slightly after your menses ends and before ovulation occurs, because once ovulation occurs, it's difficult to assess the lining. For the guy, preferably if you want to submit a sperm specimen on the spot, then in general you need to have a window of abstinence for about 3 to 5 days. So if you just did it yesterday, then it will be a bit difficult for you to get the sperm submitted on that day.
Thank you so much. For Dr. Janice as well, I have small polyps that's less than 5 mm with regular periods. And doctors say it's recommended IUI as the location of polyps will not affect implantation. Is it better to remove the polyps first before IUI, or can we proceed without polyps removal?
So this depends on how long you've been trying as well. Naturally, with these small polyps, it is very hard for us to ascertain the impact of these small polyps, even on natural pregnancy and natural conceiving, because if you get pregnant naturally, you may not know about these polyps or anything like that. So, but studies have shown with the IUI population and the IVF population, if the scan is suspicious for polyps or any lesions at all, then doing a surgery to evaluate the cavity as well as to treat the problem will help improve your rates of the success rates of your IUI and IVF. So by extrapolation, then in that case, maybe a better idea to remove the polyps first before the IUI.
On the topic of IUI, this person wants to know if it is recommended for couples to attempt it first, IUI, prior to IVF. This is for either Dr. Balaji or Dr. Janice.
So these are generally referring to couples with unexplained difficulty in conceiving. For couples with identified problems, for instance, low sperm count, then in general, IVF may possibly be better than IUI. So for couples with unexplained difficulty in conceiving, then it really depends on your age and the duration of difficulty. If you're younger, in your early 30s or maybe even late 20s, and if you have not been trying for very long, maybe 1 year plus, then it may be okay to attempt 1 or 2 or even 3 cycles of IUI before moving on to IVF if that's unsuccessful.
Anything to add on, Dr. Balaji?
Yeah. If IUI need to be successful, we need at least 1 million moving sperm to be recovered from the semen sample. I'm talking about recovery, so for insemination. If we can't recover so much, then it's better not to do the IUI.
All right. For Dr. Janice, how can we improve pregnancy chances for past incidents of ruptured tubal ectopic gestation, a surgery that was done?
So depending on the surgery that's done, whether the tube has been removed, I assume because it's ruptured, most of the time surgery has been done to remove that tube, which means you're one tube down. Again, try naturally. Definitely, there's still a natural chance. Then if you're getting nowhere with natural chances, then try to move on to IVF sooner rather than later.
Okay, this is for Dr. Janice as well. If I have a cyst on my ovaries, a retroverted uterus, I'm 30, should I immediately go for IVF or keep trying naturally first? We've only just started and we're currently in our 2nd month.
I need to see you in the clinic. Okay, it depends on how large your cyst is, whether it's really a persistent cyst or a functional cyst, but given the other factors, the retroverted uterus alone will not necessarily indicate that you should go for IVF. You're 30, you're relatively young, you haven't been trying for very long.
This is for Miss Sia. In addition to TCM herbs and acupuncture, could there be anything that we can do at home during free time, for example, like acupressure massage for us? Thank you.
Yes, couple massage will definitely be, it's good, right? Yeah, so, but for females especially, we advocate heat therapy. Yeah, so for example, like hot water foot soak or moxibustion that you can do at home as well. Yeah, so there'll be certain acupoints that you can focus on that we say, you know, that will help to warm the womb and improve the blood flow. Yeah, so these, yes, we can do at home.
Is it possible to do it wrong and then give a adverse effect, or?
It's quite hard to do it wrong. Yeah,
Okay.
so yeah.
Got it. This is for Dr. Balaji for IVF process. Is using frozen embryo better?
Yeah, currently there is a global trend of getting a higher pregnancy rate with frozen embryos than doing a fresh embryo transfer. That's because the freezing process and thawing process are now where they are very good and they are very, very well improved. So because of that, we get very high survival rate, right? And then the embryos' intactness, the competitiveness is actually maintained after freezing and thawing. So that could be one reason. Another reason could be that in first cycle, actually a lot of hormones are used. So that may compromise the endometrium to some extent. So nowadays, we see there is an increasing trend towards the higher pregnancy rate with frozen embryos.
All right. For Dr. Janice, if the woman has low egg count, is it still recommended to do IVF?
I won't say that it's recommended to do IVF straight away, but certainly the time pressure to do IVF would be higher because egg count can only decline with time and age. So you need to have an idea of your time frame and your goals in mind, and then move on with your trying naturally or moving on to IUI and then IVF along that time frame.
Right. Or freezing the eggs, like Dr. Balaji said, there's
Yes,
good chance
that's
as well.
right.
This is for Dr. Janice again. How long is the IVF process and how many fertilized eggs are transferred into the womb during IVF? Is there a risk of multiple pregnancies?
So the IVF process is not very long in terms of the actual hormonal stimulations. That goes on for less than 2 weeks before the egg retrieval. Subsequently, after the eggs are fertilized and then we transfer the embryos back into the womb, in Singapore, a maximum of 2 embryos can be transferred. If you fulfill a certain criteria in terms of age as well as the number of failed previous cycles, you may be able to transfer 3, but that's the max. Is there a risk of multiple pregnancies? Of course, when you put in 2 or 3 embryos, you might get twins or triplets. Even when you put 2, sometimes you can get 3. So there is certainly a risk because, I mean, fertility treatments, even not just IVF, but for ovulation induction and IUI, the aim is to get you more fertile, to get you try and get you more pregnant. So obviously, there will be a higher risk of multiple pregnancies with any fertility treatment.
Thank you so much. Miss Ya, for TCM medicine, are there alternative not to drink the liquid? Are the herbs available in pill format? Valid question, I say.
Yes, so alternatives are available, but the key is to understand why, you know, it is still preferred to have the liquid, you know, yeah, because the liquid is the one that we can customize for every unique patient, Whereas if it's already in a fixed formula, a pill form, then it generally works for, in general, but not very specific to you. Yeah, so then that defeats really about the purpose about coming to TCM, where it's about you and you, right? Yeah, your unique constitution. Yeah.
So pills are available, but more effective to drink, depending on.
If we want a customized blend, yes. Yeah.
I like that. Also for Miss Sia, I've had a fibroid removed before. Would the use of TCM cause fibroids to recur?
Okay, good question. Okay, so for example, in TCM, there are well-known formulas like 八珍汤, 十全, some of you, or 白凤丸. These are the common remedies for women. And I must say, be very careful when you take this over the counter on your own. Yeah, because for TCM, again, it must match your constitution. So for example, somebody with a blood deficiency issue, and if I were to apply the above mentioned formulas, no issue. But if I have a patient who's already very clogged up, very choked and stagnated, not flowing, and if I were to continue to give this medication, definitely it will lead to growth and cysts and fibroids and yeah.
All right. Next question is for Dr. Janice. We have a question next we got it?
Yeah.
For Dr. Janice, yeah. I heard stress can lead to a miscarriage. What advice do we have to reduce stress in our daily life?
I hope someone can tell me too.
Is there a pill for that too?
I think everyone's different, so all our ways of coping with stress is different. But I believe communication between the partners is really the single most important thing. So understanding your partner, keeping the communication lines open, and identifying what are the problems and what are your goals, and the time frame. That will really help a lot. I think most people are very stressed when they're trying. Basically, and then their menses comes. That's really, they're like, wow, crestfallen and disappointed. So, especially if they've been trying particularly hard that month. So the idea is to recognize that what you're doing is okay and optimal, nothing more, nothing less. And then after that, having a time frame in mind so that you know that when your menses comes, this is your next step. Yeah. So you won't. I mean, it doesn't take away that feeling of disappointment, of course, but you are not going to be like in a panic mode, about what to do, and everything. So get your fertility health consult early, get some time frames in mind, and then move on from there. I think that will help. And then it'll be helpful for couples to concentrate on other things besides this, like do things for your relationship, go for a movie, etc. Things, enjoy doing other activities together, not just concentrate on the baby making.
That's great advice. Thank you so much. Another one also for Dr. Janice. Is it recommended to try second attempt IVF or IUI straight away? Or should we give it a rest in between before the next attempt?
I think this is really personal preference because evidence has shown that second attempt IUI or IVF straight away has not been shown to have a reduced success rate. So it certainly has no impact.
For Dr. Balaji, for ICSI, is it only one sperm required? If some semen tests shows only very little sperms, what can you say about that, Dr. Balaji?
Yes, if you look at the natural conception or the conventional insemination in the IVF lab, even though we give a lot of sperm to the egg, only one sperm is going to enter the egg and fertilize the egg. So that's the basis. So we need only one sperm for one egg. So when a sperm sample is presented with very few sperm in it, then ICSI is the ideal choice for it. Because we can search for the sperm and pick up the sperm and inject one sperm to one egg. So supposing we collected 10 mature eggs on that day, so we need 10 sperm to inject all these 10 eggs. So that's how it goes. So one sperm per egg is the ICSI's principle.
That's great. For Dr. Janice, does the quality of the sperm degrade as the guy age? If yes, what's the degradation percentage?
So sperm count is not thought to degrade with age or deprove, that means decrease with age. So a 70-year-old guy can have the same sperm count as a younger guy. So, but however, the quality does degrade, is you don't expect it to be the same quality. So generally the cutoff is about 40 years of age, where you expect the mean sperm quality to be poorer.
Alrighty, let's go on to the next question. Dr. Janice, should we stop trying naturally while going through fertility treatments such as IUI so that the sperm count and quality is not affected?
So most definitely not. You have to continue trying naturally alongside all fertility treatments, including IVF. As for IUI, because it's an augmented form of natural trying, actually the doctor will recommend certain points in the cycle where you should be trying naturally to clear the sperm as well before the IUI, as well as, the best way to clear sperm is to put the sperm where it's needed as well. So therefore, you should be trying naturally.
Yay, right? It's a thing to celebrate, right? Or like, oh man, I gotta have sex with my wife? I hope that's not the case, okay? Remember, we don't wanna eliminate stress. Okay, this is for Miss Ya. Is Chinese medicine suitable for Muslims?
So Chinese medicine is not halal certified, yeah, but so for vegetarians as well, right? Yeah, so as long as the physician is aware of the restrictions, we can work within that, yeah. So whether Muslim, vegetarians, yes, we can help, yes.
She seems very personalized to the individual, I realize, right?
Yes.
That's great. Okay. Dr. Janice, my wife has had 2 miscarriages in a row. Does IVF or IUI help with help with her successful pregnancy?
So essentially, IVF and IUI helps you to get pregnant. It does not decrease the risk of miscarriages. So we have to be very careful, okay, in identifying this. So the idea behind doing IUI or IVF is to make getting pregnant more efficient, because sometimes after having 2 miscarriages, you take breaks in between of not trying, then you will get older and then your ability to get pregnant or conceive naturally gets harder. So that's how IUI and IVF helps to make it more efficient to get pregnant in the first place. And subsequently, you need to do investigations to check what is the cause of the miscarriages. In most cases, nothing can be done, but there are some cases where it's due to an overactive immune system or some other underlying clotting issues, where it may be amenable to certain adjuncts or treatments that can be used, whether you're trying naturally or you're doing IUI and IVF, to increase your chances of, or rather to reduce the chances of miscarriage.
Okay, thank you, Dr. Janice. Next question, does having little menstrual flow, means it's over between 2 and 3 days, affect fertility or make it difficult to get pregnant?
No, if your lining of the womb is normal and there's no other problems detected, so you should get a fertility health consultation with your doctor, get everything checked to make sure that things are fine.
Dr. Janice, someone wants to know how often should they have sexual intercourse to increase chances of natural fertilization?
So if you're ovulating regularly, then we would advise sexual intercourse about 5 to 7 days before ovulation, every other day until the time of ovulation or when you think you have ovulated. So if your ovulation test kit is positive, that's the time to stop trying rather than to start trying.
Oh, the more we know. Okay. Dr. Janice, does the pH level affect when I have bleeding while trying naturally? It means I bleed while we try naturally.
I think it is quite common to sometimes have a bit of bleeding when trying naturally. Due to the whole process and the effect of the act of intercourse. But essentially, if you are having bleeding all the time, persistent bleeding or excessive bleeding, I think you should get checked, because there might be a condition in the vagina, for instance, cervicitis, inflammation of the cervix, or inflammation of the vagina that might be causing the bleeding. As for the pH level, the thing is, we don't really look at pH level at your when we are talking about your chances of conceiving naturally. So we're not. The bleeding should not affect your chances of getting pregnant in a sense by affecting your pH level.
That's great. This is open to any of the doctors. I want to know, does weight affect either gender or both or none? I'm not sure if I understand the question. Do we understand it? Okay. We're going to move on to the next question. I'm so sorry if this person...
Oh, I think I get it.
Okay.
Whether if the male partner is overweight or if the female partner is overweight, does it affect your chances of pregnancy?
Chances of pregnancy.
Yes.
In my head, it's like, okay.
Yes,
else.
I think definitely for both genders, not just the female or the male. So overweight males sometimes can have a low sperm count. Essentially, two overweight partners can sometimes find it difficult to actually have intercourse. I mean, the analogy would be the pandas. Yeah, so something similar. So definitely people in the extremes, not just actually overweight, but underweight as well. So people in the extremes of the body mass index range will find it or take longer to conceive, find it harder to conceive.
Anything to add on, Dr. Balaji? Okay, great. This is from Miss Ya. Is it true that fruits are not recommended when taking TCM medication?
So in general, fruits are considered cool, raw, cooling, right? Yeah, so that is why I think some physicians might have advised patients, to cut out these when you're taking Chinese medicine. But in general, that's not true. We don't tell patients, okay, just because you're on Chinese medicine, then you cannot take fruits. In general, we will advise to have a 2-hour gap between the fruits and the Chinese medicine. Just like when you're taking Chinese medicine, we don't encourage you to, take coffee, tea, milk, things that are of conflicting nature together with the medicine. So a 2-hour gap. But there are cases where physicians find that, your constitution, certain fruits are not suitable for you. And then, then it's not totally everything, but maybe certain types of fruits.
All right. Dr. Balaji mentioned 1 million sperms is required upon sperm recovery. What happens if we opt for IUI and we don't get 1 million sperms? Am I saying it? Was it 1 million or 1 million? Okay, great. Do we change to IVF halfway?
Okay, this 1 million is the cutoff to achieve a pregnancy, successful pregnancy for IUI. In case, if the total recovery is less than 1 million, usually we discuss with the patient as well as with the doctor in charge, and then we come to a conclusion whether to go ahead. Most of the time, we go ahead with the IUI. Then the doctor will advise the patient to go for more sexual intercourse, right? So that to increase the availability of sperm more and more to the eggs. So this is what we do. You can't change to IVF when the sperm is low in count. We change the IUI into IVF only when the woman produces more than expected number of follicles. So we expect about 3 to 4 follicles to be developed for an IUI. Supposing she develops 10 follicles, 12 follicles, then we change it to IVF. So we don't change it halfway because of recovery is poor.
Follow-up question. Oh, sorry.
Oh, sorry. Just to add, you can't change to IVF halfway because the ovulation injection has already been given. By the time we know that there is not enough sperm on point, the sperm recovery, you can't extract the eggs already. You don't have time. And also for IUI, we're aiming for 3 or 4 eggs. So there's not, it's not very efficient to do the egg retrieval just to get 3 or 4 eggs from the IUI. But that being said, we still do go ahead with IUI because you really need only 1 sperm for pregnancy. So in fact, sometimes, I think there was one case, we had less than 1 million sperm recovery and we had 3 pregnancies in that lady. Yeah, so it is quite possible.
All right. Is every sperm batch constant then, Dr. Balaji or Dr. Janice?
No.
Okay. Asked and answered. Next question for either Dr. Janice or Miss Ya. Will caffeine affect fertility for either men and women? How much is too much?
1, 2, 3.
Okay, so I would usually advise about 1 cup a day for both men and women. So it's believed that excessive caffeine couples who take excessive caffeine take longer to conceive. That's what the studies show. What the exact effect is, we don't know. We believe that caffeine is a vasoconstrictor, so it sort of constricts your blood vessels and therefore decreases your blood circulation. And that's, Missy already said, blood circulation, if it's no good, it's not good. Yeah.
Same.
Same, okay. It's like retweet. Retweet. Okay. Next question for Dr. Janice and Miss Sia as well. To have fresh egg retrieval, how long is TCM needed and Western as well as TCM medicine to go together?
So for TCM in general, we'll say at least 3 months prior. Yeah, but it's always good, like let's say if you already know you're heading this way, and it's always good to seek help earlier. So if there's a need to, then we can start earlier. But in general, 3 months before.
Anything to add on? Okay. And this is the last question. I have irregular menses. How can I increase my chances of conceiving? Dr. Janice.
Okay, so we need to determine how irregular your menses are. It's because basically patients, they have a preconceived notion of how their periods should be. And so they will come and say, oh, my periods are very irregular. But actually it turns out that they are quite okay. Yeah, so you should go to see a doctor, check really whether your menses is very irregular, see whether there is ovulation happening. It's just that maybe it's happening in a window that is a bit larger. So for instance, some people, we say about like if you have a cycle between 28 to 35 days, then your ovulation is pretty consistent over a week. And then that would be better for you to try. But some people ovulate over like 2 weeks. That means some cycles they will ovulate earlier and then some about 1 week or even 10 days later or 2 weeks later. So it's not that they are not ovulating, so which means that they have a chance of conceiving. It's just that it makes it more difficult to try. In general, if you want to increase your chances of conceiving when you have such a large ovulation window, then the recommendation is to do about 3 times a week so that there's always sperm. Yeah.
Okay, thank you so much, Dr. Janice. Thank you so much, Dr. Miss Sia. Thank you for answering all of your questions. We answered close to 50 questions this evening. And with that, we have wrapped up our Q&A segment. This is just halfway of our seminar. We've got more speakers joining us later on, okay? I'm kidding, I'm kidding, I'm kidding. I know, we've got to stretch, but yeah, thank you everyone for attending. If your questions were not answered during the seminar, the doctors will still answer them via article through ilovechildren.sg. Simply log onto the website, check ilovechildren.sg for more articles on fertility health. For those joining us virtually today, don't forget to submit your feedback form to stand a chance to receive a gift pack from Clear Blue worth more than $100. Terms apply. And if you've missed any part of this seminar, maybe you fell asleep or you want to replay the answer to the questions that you were asking earlier on, you can always view the recording on I Love Children Singapore's Facebook page. If you've been trying to conceive for 6 to 12 months without success, visit www.ilovechildren.sg today to sign up for a fertility consultation or TCM consultation. Terms apply, of course, as well. Thank you so much for joining us. This has been Know Your Fertility Wellness Hybrid Seminar. The more you learn about trying to conceive, the more you realize that it's not just about getting pregnant. It's also about staying healthy and keeping your body in optimal condition. Make the decision to have a baby is a very momentous occasion. We all know that, right? So here's wishing everybody lots of baby dust, and until we see you next time, good night.